All right, good morning, everyone. There you go. All right. So we passed out some index cards if you could. If you have any questions, please write them down and hold them on to the end of the session. We'll collect them and have our wonderful presenters today answer them for you at the end. We'll have about 15 minutes for any questions, so please hold off. We'll grab them and give it to them at the end. So without further ado, raising a child with diagnosed with PI, we have Elizabeth Arias Rubio and Ronald Ferdman.
Welcome, everybody. Thank you for coming. I know it's very late in the session, so we appreciate you showing up. And I'm going to go ahead and start, and Elizabeth is going to do the second half of this. So my name is Ron Ferdman. I'm from Children's Hospital Los Angeles. And we have no disclosures, no financial disclosures. Here are some learning objectives, which I won't read through. Basically, it has to do with parenting. I'm just going to go ahead and start so I stay on time and don't hog all the time and not let Elizabeth talk. So the agenda today, we're splitting this up, and I'm going to put the so-called medical viewpoint of raising a child with PI, and Elizabeth is going to do the psychosocial viewpoint. And as you can imagine, there's a lot of overlap, and I have a couple slides I can kind of skip through because they overlap too much with hers. So let me start with the question, who is the expert in raising children with PI? And the answer is, of course, me. That's why I'm here. And of course, I'm just being facetious. You know, I'm not the expert. But I think this is it's kind of a personal thing, telling people how to raise their own children. That's kind of weird. So I think if I'm going to doing something personal, I should tell you a little bit about myself. I've been providing medical care to kids with PI for about 20 plus years. I've seen a lot of examples of excellent parenting. I've also seen some examples of not so excellent parenting, and I try to learn from both. I'm a pediatrician, so I'm kind of all about kids and my training. And I've raised four, and I put healthy there on purpose, 4 healthy children, because I know raising healthy children is a lot different than raising kids with chronic diseases. And I don't want to in any way, put myself in your shoes, because I've been blessed. I have healthy kids. This is my family here. All my kids and their significant others. They all have significant others except one of my sons. So if somebody knows a 20-something single girl, come talk to me after the presentation. So if it's not me, who is it? And the answer, of course, is you. You are the expert at raising your own children. But chances are, except in big gatherings like this, you haven't seen a lot of kids with PI. You may be the only one in your social group who has a child with a primary immune deficiency. And also, things change. Nothing stays the same. You think you have everything down, and then they change the rules on you. Doctors change, nurses change, your pharmacist that you love changes. You go from different schools and different teachers. Your insurance is changing. You move different places. Everything changes. But you are the only constant in your child's life. When the child gets older, they're going to be the only constant in their life, so they need to learn self-sufficiency skills early on, so when you're not there to guide them when they move away, they can take care of themselves. And what I'm going to do, even though this is kind of medical, I'm going to give you a little bit of philosophical viewpoint of mine, and this, again, is personal opinion. This is not facts. It's not something from a journal article or a textbook. I'm going to give you a little bit of theoretical stuff and then hopefully some practical stuff. I'll start with the philosophical. My philosophy, summarized for raising children with primary immune deficiencies, is make the child the center of his or her own world. And another way of saying that is you want to normalize your child's life as much as possible. And to me, these are kind of the same thing. And to kind of give you an example of this, this is how I see a lot of our parents coming in. You have the primary immune deficiency as the most important thing in the center of the child's world, and everything, including your child, the family, sports, work, school, kind of revolves around the primary immune deficiency. What I would rather see is you take the primary immune deficiency out, you put your child down here, and then you put the primary immune deficiency as one of the things that circles around a normal child's life. So PIDD is one of the many important things revolving around your child's world, but it doesn't define your child. Obviously, Each one of these is going to change in time in both importance or size, depending on age and different situations. So for examples, sometimes the PIDD is just so bad. There's too many infections. Your child is just too sick. There are too many things going on. It just dwarfs everything else. Everything else shrinks in comparison, and you have to spend a lot of time on the PIDD. But for most children, especially school-age children, school is the biggest part of their lives. Normal children go to school, and so your child wants to feel normal. Going to school is a big deal, and things like family are still there and obviously too young to be working, but your child is in the middle and now school is important. As the child gets older in the teenager years, friends may take on bigger responsibility. Family may shrink a little bit, school may shrink a little bit, maybe something like sports will take more responsibility or more, of their time. Sometimes the family events take precedence. It's grandma and grandpa's 50th anniversary. We have to kind of put your disease aside and go off to, Maryland to celebrate their anniversary. Or mom needs an operation, and we have to take care of that, and you get put aside a little bit. So family sometimes can take over. In young adults, their friends become more important. Their own family, maybe they're starting to have kids. Their work becomes important. So as they go through different ages, different things become important, and they all revolve around your child's life. I think another thing to remember is parenting does not occur in a bubble. Wouldn't it be nice if you had the parent here and you just kind of told the child what to do and they listened? That'd be great. But what happens you're all laughing, so obviously you all are parents. What happens is you're not as kind of big and powerful as you think. You're pretty much on equal footing, it seems, with the child. And it's not a one-way arrow, it's back and forth. And, oh yeah, there's another parent, isn't there? So you have to take that other parent into consideration, and there's an interaction between the two parents. And then there's other significant caregivers. In my family, it was Aunt Olga. She was the matriarch of the family, and what she said kind of went. And she may not like dad too much and get along with mom, and that's their interaction. And then they're going to interact with the children. And then, oh yeah, there's siblings too, don't forget about them. And they all interact with each other. And then they all interact with the parents. And you get this big mess. And then the real parent comes in, which is school, TV, internet. And then they interact with everything. And so this is what parenting is. It's a messy, families are just messy. And there's all these things influencing you. And just to make things even worse, your child's not going to stay a sweet little 2-year-old. They get bigger and they get bigger, and the parenting methods you use when they were 2 are not going to be the same as you use when they're 5 or 15 or 18. So you've got this huge mess. And so I think it's just something to realize that anything that affects the parents will affect their parenting. Anything that affects the child will affect parenting. Anything that affects the family will affect parenting. And chronic illness just affects everybody and everything. And I think just knowing this allows you for self-evaluation. You maybe need to step back and going, why are things going so wrong? And step back and look at the whole picture and say, okay, it's maybe not me, it's kind of everything that's happening. What do the studies show? I mean, I'm usually giving medical talks, and there's a lot of studies on the interaction or information on parenting children with chronic diseases. There's actually surprising, very, very few studies looking at parenting of children with primary immune deficiencies. There's just almost nothing in the literature. And so it kind of raises the question, is parenting issues of a child with a primary immune deficiency the same as in a child with any other chronic disease? And just to make sure I cover, the answer is yes and no. And so let me cover the no first. The impact of chronic disease on family is very well known. You have a loss of sense of normal family life, isolation, you can't go out and be with people, uncertainty about the future, increased family conflict, all the deleterious effects on the other siblings who don't even have the primary immune deficiency. These are the slides that I think I'm going to leave to Elizabeth a little bit, but you have the impact of chronic disease on the children, not only their physical health, but their daily routines, and they can internalize problems and get depression and anxiety, or externalize problems and have aggression, social difficulties. Impact of chronic disease on the parents. I don't have to tell you this. You feel like your demands have no end. You don't have enough energy to do anything. Anything except taking care of the child goes by the wayside. All your hobbies are gone. Hanging out with other people, guilt and anger. Why me? And then actually, parents of children with primary immune deficiencies have increased medical problems themselves, probably related somewhat to anxiety and not taking care of themselves. And then you have the impact on the well child, the siblings. Why did my sister get sick and not me? How come they're spending all their time with Johnny but not me? They're told, we're not going to punish you, but you have to do the chores and your brother doesn't have to do the chores. And they feel bad about that. And then they feel guilty about feeling bad about that. So just a lot of interaction. And Elizabeth will spend more time on this. And what it turns out, I think a general principle is that the specific chronic illness does not predict the family's adjustment to the disease. What does predict your adjustment to having this disease in the family? One is the severity of the illness. The more severe the illness, the harder it will be to adjust. The chronicity, how long it lasts. If you're sick for 10 days, it's a big difference than if you're sick for 10 years. But what's most important is the family and social environment. How you react to your child having a primary immune deficiency is probably exactly how you would have reacted if your child had diabetes, or if your child had cancer, or if your child had epilepsy, or any type of chronic disease. So it's not specific to the disease, it's specific to the chronicity, how severe the disease is, and how well the family copes, and in what way they cope, and what other influences the rest of their community has on them. But let me switch to the yes side. How is raising a child with a PIDD different than other chronic diseases? And I'm going to use diabetes as an example to contrast PIDD with. So I don't want you leaving here and saying, oh, Dr. Ferdman said that diabetes is no big deal. PID is a lot. Diabetes is a very serious chronic disease, but it's a disease I think everybody's familiar with. So I'm going to contrast it to immune deficiency. So I think the first difference is a lack of control. So with diabetes, if you watch your diet, exercise, maintain your weight, monitor your glucose, take your insulin, you can keep things under pretty good control. With an immune deficiency, you do everything right, but the kid who sits next to your kid at school gets sent to school with fever and a chicken pox, and it's just out of your hand. You can do everything right, and you have this lack of control. Lack of familiarity with others for a primary immune deficiency. So you tell somebody your child has diabetes, and they say, oh yeah, 2 of my uncles have diabetes. Do you have to give insulin shots? You tell somebody that your child has chronic granulomatous disease, and you get a blank stare. And you explain it's an immune problem, and they say, oh, your child has AIDS? So they just don't have this understanding at all. Delay or difficulty in diagnosing. Your neighbor's child was healthy until 8 years old, got sick for 2 weeks, and then they did a urine test and found out she had diabetes. Your child was sick since she was 6 months old, and nobody figured it out till she was 7 years old, and it could only be diagnosed by a gene test, which took 9 months for your insurance to approve. Multiple unexplained problems. So with diabetes, you're told your child is at risk for kidney problems, and we have to monitor their renal function, their kidney function. With PIDD, so few children have this that the doctors really don't know if a kidney problem is due to this or there's something else going on, and your child has to get a kidney biopsy to see. And then lastly, lack of treatment. There's no cure for diabetes, but the treatment is well known. Diet, exercise, insulin, monitoring. With PIDD, you're told that research is ongoing to find a cure. I mean, we love the research, and thank goodness everybody's doing the research, but that doesn't really help you right now. That 20 years from now, they might figure out what's wrong with what the best way to treat your child. So again, there are things that I think are unique to primary immune deficiency. Next thing, be the expert in your child. What do I mean by that? Keep a diary of important things and important facts, actually a written diary. A brief history leading up to the diagnosis, because again, doctors change. Copies of important labs, and you don't do every single lab. A list of up-to-date list of medications and allergies, an up-to-date list of all their physicians, and then a kind of chronology of things that has happened. Because I can tell you as a doctor, we're not going to remember every little thing. We can go through the chart and search it all out, but that takes a long time. If you have that there, that's very, very helpful. Be prepared for medical visits. Again, this is the doctor half of this of me talking. Write down concerning events since the last visit. We don't want to know every little detail. So Tuesday morning at 8 o'clock he sneezed, and then he said his knee hurt, but then it went away 10 minutes later. We don't want to know all that stuff, but the important stuff, absolutely we want to know. And write it down, because you will forget. Everybody does. You think you will remember, but you're not going to remember. Bring the medicines, because a lot of times there's a confusion over the medicine. Bring any important paperwork, toys and food to occupy your child during the visits. Be on time. This is kind of selfish. I don't want to run late, but it's actually for your own benefit. If we're rushed, if you're a half hour late and our next two patients are already there, you know what? You may not get the time you need. We make a mistake because we're trying to go through the visit too fast. So it sounds selfish, but it's actually kind of for your own benefit as well. And then take notes. Ask for written instructions. Ask for what you want us to do. Make sure you understand everything that was said. Medications. Children with PIDD, unfortunately, they need a lot of medicines. And effective management of the medicines is very essential. You want to give age-appropriate explanation why they're taking the medicines. Acknowledge the unavoidable side effects. I know this makes your stomach hurt a little bit, but we really have to take it, and we'll do something to help your stomach feel better. If you're taking medicines, set an example, take them together. Give choices. I kind of compare buckling a seatbelt to giving a medication. You can ask, okay, do you want mommy to buckle the seatbelt, or do you want to buckle it yourself? Do you want to buckle your seatbelt first or your sister's first? Do you want to sit on this side of the car or that side of the car? But not buckling the seatbelt is not an option. Same thing with medications. Do you want to take your medicine with juice or water? Do you want to take your medicine before or after this commercial? Do you want to hold the spoon, or should daddy hold the spoon? But not taking the medicine is not an option. And so we want to convince the child, but we actually have to kind of convince the parents also to give the medicine. We want to make sure you know the medicine, why we're giving it, the side effects, when you need to call for help, how to store it, what time to give it. Is it a 10-day medicine or a 10-year medicine? If it's an as-needed medicine, why do you start it? And knowing all that goes towards teaching the child. I think that, I hate to hear it when parents come in and say, my 8-year-old, I give him the medicines and I tell him to take it, but he just won't take it. Your job is, we want to give them responsibility. Their job is to remember to take the medicine. Your job is to make sure they take it. So it's a shared responsibility, and they get more and more of that responsibility as they get older. You don't need to win all the battles. Same as kind of don't sweat the small stuff. It's essential that your child takes the medicine, doesn't get around sick people, gets their IVs if they need it, all that kind of stuff. It is really so important that you could fill in anything you want here, that they stay up a half hour later one night, or they don't get a mohawk or dye their hair red or build forts out of pillows in the couch. You can't win every single battle. Discuss medication issues with the healthcare team. We know that chronic medications are hard to take. There's a lot of good reasons why you don't take it. It may be side effects, worry about future side effects. Maybe you don't think the medicine's working, or the child doesn't need it, too expensive. Medication fatigue, just sick of taking the medicines. Some of these are negotiable. There might be alternatives or holidays you can go on, so let us know. And beware the mismatch between what we think you're taking and we have on our chart with what you're actually taking. Because if you're not taking it, let us know. Because sometimes we give medicines as part of the diagnostic process. We want to see if you get better. Some medicines have a very slow onset of action, so it doesn't look like they're working, but it may take weeks or months. Sometimes you stop the medicine, you don't see they get worsening. Well, it may take months or weeks for the medicine effect to wear off. Some are used to prevent rare occurrences, so to prevent a pneumocystis pneumonia, which may only happen once a year. So yes, you have to take it 365 days a year to present that one time, because that one time could be very, very serious. And it may, if we think you're taking a medicine and not getting better, we may order more tests or give more medicines, and it just makes everything more complicated. Painful procedures. This is a part, unfortunately, of life with most kids with PIDDs. Don't downplay the inch. I really don't like it when parents say, it's just a pinch, you won't feel a thing. They hurt. Blood tests hurt. IVs hurt. Don't call them a sissy. That's not going to help anybody. Emphasize it's not a punishment. It's not their fault, especially in young kids. We're not punishing you for doing this. And acknowledge the pain and the procedure. Yeah, you have to get the IV in. Yeah, I know it's going to hurt, but I'll hold your hand. We can do something. You can help you. And so distract them. Don't bribe them, but you can do rewards after you did so well. You were going to go to McDonald's and then get a smoothie or something. Discipline. And this, I don't know if I'm going to make you angry with all this, but you are their parent. You are not their friend. They're going to have many, many friends. You are going to be their only parent. So you have to make the hard decisions sometimes. Children need limit and consistency. Kids with PID need to be treated the exact same way as their siblings without PIDD. There are going to be exceptions. But failure to discipline normally actually makes them feel bad. Why aren't they treating me like my sister and my brother? They kind of get to realize that after a while. And then you start getting behavior problems. He knows you can get away with it. Kids are smart. At school, the teacher can't discipline them, or their friends don't want to be around them because it drives their friends' parents crazy because they can't behave. And then lastly, I'll start this last two slides. Disclosing the diagnosis. This is something we don't talk about too much. Who do you tell that your child has a PIDD? I mean, it's nothing to be ashamed of, but still, you fear that your child will be treated differently, will be teased, will be shunned. Other people don't understand it. They think it's something contagious, even though their children is much higher risk to your children than the other way around. So who do you disclose to? I mean, eventually you're going to need to let the child know why they're so sick, why they're taking medicines. If they're starting to refuse medicines, they have to understand why they're doing it. Other family members to help you with your own support. The school needs to know so they know what precautions to take, if they need special services, an IEP, and friends, good friends to help your child cope. So I think disclosing is very, very important. Be honest if you disclose in age developmental appropriate manner. Say something wrong with your immune system and you need this medicine to help to keep you strong, to keep you healthy. I think for a young child that's plenty. And it's okay, quote unquote, to give bad news or not have answers for the hard questions. Why do I have this disease? How come I need this IV? Am I going to be sick my whole life with this? I don't have good answers for those questions. But you have to be as honest as you can. Emphasize there's no fault. You didn't get the disease. Nobody's fault. Yes, you're going to be sick a long time, but we're going to deal with this. We're going to get through this together. And if you're having a hard time, take advantage of physicians, psychologists, counselors, and social workers. So I will switch there.
Good morning. My name is Elizabeth Arias. I'm a social worker at Children's Hospital Los Angeles. I've been a social worker now for 10 years. 5 years, I worked initially in Children's Hospital in their mental health unit. So I worked with children with mental health diseases or diagnosis, as well as children with chronic illness. And now for the past 5 years, I've been working in the immunology clinic at Children's Hospital Los Angeles. So like Dr. Ferdman mentioned, there's a lot of overlap in terms of the psychosocial perspective and the medical perspective. Initially, when a child is diagnosed with PI, many parents experience feelings of fear, anxiety, the initial shock, sadness, guilt, hopelessness. You can name any type of feeling, and you probably have experienced it when your child is newly diagnosed. And sometimes there's even a sense of relief that finally doctors were able to tell me what diagnosis my child has, and now I know that there's a treatment for it. I go on to the family system because it's very important, and I typically go into directly with the parents. How are you coping with your child's new diagnosis? Typically, studies show that children with chronic diseases, the families, or a child that has a chronic disease within a family, there's usually more stressors. What do I mean by that? Typically, you're going to be seeing a lot more medical specialists. There's more appointments, of course. There's more medications involved. There are just a variety of factors, insurance bills, financial stressors, perhaps, how difficulty or how easy it is or not that your child is coping with a new diagnosis as well. And it's really important. One of the things that we always ask is, perhaps, when was the last time that you yourself initiated in getting a physical? Are you taking care of yourself? This is huge for us. Why is it so important for us to know this is because you're modeling for your child. How you're taking care of yourself is a model for them, how they're going to take care of themselves as well. If you're not taking your medications and you become sick, they're not going to want to take their medications either. So it's just modeling that positive behavior when someone has a diagnosis or not to continue it. And the reality of it as well is that we all have a breaking point. There's a lot of stressors involved, and it impacts our relationships with other people. Sometimes it impacts our own mental health, our physical health, our emotional health. And when we reach that point, it's really important to really seek out your support systems. It's really important here for you to become close to your family or to reach out to friends. Sometimes you want to go on a date with your significant other. Who's going to take care of the child? It's really important, perhaps other community resources, going to churches, attending conferences such as PI, so you expose yourself to other families that are going through something similar as you, and your children as well get to meet other kids that have a similar diagnosis and what they're going through in terms of treatments, IVIGs or sub-Qs. A child will cope best with their chronic illness if the entire family is supported. So recognize your own needs. This is really, really important again. You cannot take care of a child with special needs or with a medical condition if you yourself are not taking care of yourself. Going on, Dr. Ferdman did discuss a little bit about the siblings. Do they really understand what's going on? If you have other children, it's important to keep them in the loop as well, because they're going to question themselves: why do I not have this illness? Am I going to eventually get it? And a big thing that comes up is many times vacations are canceled, or there's a change of plans within the family system because your child with PI becomes sick, so they have to be hospitalized, or you miss one of your other children's birthday parties because of X, Y, and Z. So it's important to keep them in the loop. If your child does become hospitalized, what's going to happen to your other children? Who's going to take care of them? Are they allowed to go to the hospital to visit their sibling? And it's important for you guys, too, to look at how the other siblings, your other children, are behaving in school. How are they coping with their sibling's diagnosis? Are they fearful? Are they annoyed? Are they causing problems at school? Are they failing their school? Are they having a difficult time just in general? Do you see more sadness in them? Do you see more fighting between siblings? A certain amount of fighting is completely normal, but if they're just completely avoiding their sibling with PI, there's other issues that we want to definitely address. And this is when you seek out mental health services, of course. If there's mood disturbances in your child, if you see that they're having difficulty socializing at school, or they're having other self-esteem issues, you want to definitely address this. And it's important to treat, each of your children are unique individuals, and they want to be treated as such. So it's just really important for you to recognize that. And don't compare your kids. They don't like that. And then now with the child themselves that has a PI diagnosis, how are they coping with it? Are they adjusting to it, or are there warning signs that you need to look out for? We want them definitely, and this isn't a generalized, I'm breaking it down in terms of ages of what we expect and how you can assist them, but in general, are they actively participating in their treatment? Are they able to answer questions when the doctor asks them? This is going to be based on developmental age where they're at, but at the same time, if they start to have severe anxiety attacks just entering the hospital, then we need to seek additional services. How are they functioning behaviorally? Are they having temper outbursts? Are they aggressive? Are they non-cooperative when you're trying to give them sub-Q or during an IVIG? How are they responding to the medication? It's important for you to know as well. How are they taking it from an emotional standpoint? Are they sadness? Do they experience frustration, poor social skills, and then, of course, physical limitations? You're going to see that yourself in what exactly are they able to do, and also if they have somatic symptoms, meaning are they telling you that they're having difficulty sleeping, or there's a change in their eating habits, or stomach aches or headaches. We want to rule out if this is if this is side effects from medication, or is there something else going on psychologically that we need to address further. And it's really important, the quality of life of your child. Like Dr. Ferdman mentioned, we want them to have a normal life as possible, meaning that let them be involved in sports if they're able to. I'm going to go a little bit faster. So this is in terms of infants, toddlers, and school-age children. Here we expect the parent to be a lot more hands-on. So your child is going to look for you for comfort. So here, hugging them, telling them that it's going to be okay. Of course, not lying to them that the procedures aren't going to hurt. No, we want to be honest with them, but at the same time, be empathetic. I know it's going to hurt, but I'm here, honey. I'll hold your hand. I could give you, I'll hug you, just to provide comfort and care for them as well. Again, you want to be consistent in terms of limit setting, but you also want to, if you have an infusion that's going at an infusion center or within the clinic, you want your child to be prepared with snacks. If they're going there, it's going to be a long time for doctor's visits. Make sure that you take items that they enjoy, toys, something to keep them entertained, because it is difficult, and you do want to also use distracting methods if they are going to get poked and prodded. A school-age child from between 5 and 11, they have a stronger sense of self. Here's when they're trying to win approval, demonstrating their abilities. So school is really important for them. And they're developing a better sense of self, but at the same time, it's not completely logical in what they think in terms of why they have a PI and what it means for them. So you definitely want to emphasize, as Dr. Ferdman mentioned, that it's not their fault. They're not being punished. You want to use your doctors and your medical team in explaining it a little bit better, but not, of course, in detail, exactly what they have, just in terminology that they're able to understand developmentally. Here you want them to be able to answer questions when they go into treatment, be active, and you yourself could further discuss in details exactly what's going on, but give them the opportunity and encourage them to talk directly with their own doctors and physicians. Because eventually we want them to become self-sufficient adults, and the more they practice that, the more comfortable they're going to be in talking to their physicians about this. And of course we enter adolescence, and this is, I believe, one of the most difficult phases, because there's a lot of changes going on, not only in terms of body changes, but here's when the adolescent wants to become more independent. And yes, we have the sense of, we want to give them more responsibility. At the same time, we don't want to completely just, all right, you're an adolescent, you could take your medication now, and believe that they're actually taking it. No, here's the time where we still have to monitor. Not as much, we're not going to give it to them and say, okay, take your medication, but from a distance, all right, you know what you have to do. Did you take it? Every now and then, ask them, and just really encourage that ongoing interest or information about their own PI diagnosis. And this is where the physicians are able to tell them, and you yourself are able to explain a lot more into detail why it's so important for them to continuously take their medications or take care of themselves in a healthy manner, because they're going to eventually do it by themselves. So we want to make sure that they have a strong foundation already from infancy, childhood, and then into adolescence, when then they're going to go on their own, and above 18, they're going to be doing this on their own. So as Dr. Ferdman mentioned, children need structure to thrive. This is very important, parent consistency. If you're don't threaten your child. If you're really going to give them a consequence, follow through with it. Otherwise, they're going to learn inconsistency with you, and they're going to try to get away and push further with you. So have expectations for them, have a routine. Children thrive on routines as well. They know exactly, they have more control of their environment when they know what's going to happen on a day-to-day basis. When I get home from school, I know I have to do my homework, I have to do my chores, we're going to have dinner, and then I have a bedtime to go to. You are the parent and their constant role model. I can't emphasize this enough. It's really important that we don't overcompensate children because of their chronic illness or feel guilty about it, although it does happen. We want to make sure that we're consistent, because this can lead to behavioral, emotional, and medical adherence issues, and it could impact the overall well-being of your child. Medical management, I'm not going to go too much into it because I feel that Dr. Ferdman already covered it. The more organized you are, the better off you are, honestly. If you have a binder, if you have a folder with information, this is just going to help medical sessions go a lot faster, appointments, or just whenever there's anything that if you become hospitalized, you already have the information. In terms of school, disclosure is important to school, and the reason why is for safety reasons. If your children are taking medications at school, it's important for the school to know, and if they need certain medical interventions or if they have any adverse reactions to anything, the school needs to know about this for safety reasons. Other reasons, too, is typically children with chronic illness, such as PI, tend to miss a lot of school. So it's important for the school to know, and there are other programs as well, such as an IEP or a 504 plan. Typically, children with PI will be able to get a 504 plan based on their medical diagnosis. And this is important to know because this is a federal program that is federal law that they need to provide these services to your child and not penalize them for not attending school every single day, which can happen. If you don't have a 504 plan, you put yourself at risk at times to getting fined because your child isn't attending school. Insurance bills, depending on the type of insurance, you know that's the type of coverage that you're going to have. Make sure you have phone numbers with you at all times. You never know when you're going to get a bill from your insurance, and usually it has a phone number there to call. Call immediately. Don't leave it for last minute, or if you're getting billed from the actual clinic that you go to, make sure you ask to speak with their financial counselor, or you ask to speak with a case manager so you could get further information as to why exactly you're getting billed. It's important to know your specialty pharmacies, their phone numbers, vendors. It just, again, organization makes it a lot easier to deal with issues that come up. Connect to your resources. The fact that you're already here is great because you're connecting with other families and you're receiving information that is going to be useful for you to cope with as parents with children with PI. And the biggest thing is self-care. I can't emphasize this enough to parents, is taking care of yourself. Really, really take care of yourself, because having a child with PI is very, very challenging. You're going to go through emotions at times, or very difficult and stressful situations that you're going to need help and support. And this is where you reach out, again, to your resources, reach out to your families, to your friends, whoever it is that you consider is able to assist you in these manners, do it. Again, take care of yourselves, take care of each other, and thank you for allowing us to speak today. We could have a presentation all day on this information. So one of the questions is concerning overcompensation. We give our son little toys and treats each time he has a surgery or procedures. Is this overcompensating, and will this be problematic for him? In this case, absolutely not. I think it's important for them to receive some type of prize or some type of positive reinforcer. We understand that it's very difficult to have any type of procedures, getting your blood drawn every time that you go to the clinic, or shots, or getting your IV treatment every month or every week with sub-Q. We know this is difficult. So no, it's not overcompensating. What I mean by overcompensating is giving them everything all at the same time and whenever. And not just because they're having a difficult procedure, but just because you're trying to reduce a tantrum, for example, at the store. They want a toy, but they don't really need it, or maybe you don't have the money for it and they throw a tantrum. We don't reward that tantrum with the toy, with buying them the toy. Absolutely not. That's what I mean by overcompensation.
Yeah, if I could just, I agree, but if I could just add a couple things. I think it's important that the child understands that they're going to have that procedure or surgery one way or another, and you're just kind of giving them this because, you're rewarding them for doing it well as can be done. And you have to set limits, and the limits have to be known ahead of time. So, the first time they get a sticker, the second time they get ice cream. It can't escalate up to, okay, now I want a Nintendo system, and the next time I want a car. And so it has to be generally known that it's a reasonable prize, and it doesn't always have to fit. It's not like you're getting a bigger surgery, so now you get a Ferrari, and you're getting you're getting your haircut, and you don't get a sticker. You're just getting, something to reward to help you feel better. Because, surgeries are big things. It's not to be taken lightly. That's a good question. So I don't know if I can answer this question. So what resources are available for children who have been bone marrow donors for their siblings who are struggling emotionally with the role they have played in the sibling's life and health? So you have a sibling who donated their own bone marrow, if I'm understanding this, to their a brother who donated their bone marrow to his sister. What resources are there for that brother? And I don't know if there's any bone marrow donor specific resource out there, but I think, talking to a psychologist or a psychiatrist or social worker is just general. But I don't, to my knowledge, there's no bone marrow specific. I know we have a very large bone marrow transplant center at our hospital, and they have social workers and they have psychologists on staff. But I don't know if it's specific for that, so I wish I could give you, whoever answered that, a better answer.
Again, I'll I don't think so. I don't know of any resources, but if you email me, I can get in contact with the social worker from the DMT unit, and I will be able to actually forward that information to you if such resources exist. I think that's a great question.
So one more question is, what is the best way to explain to a 5-year-old child that he has a chronic illness and the importance of doctor's appointments and medication, and how to explain how he is different from other children? And part of it, I'm not trying to avoid the question, but part of it depends on the emotional and the emotional age of the child and the developmental age of the child, and not just a chronological age of 5 years old. But I think it's to a 5-year-old, and please add if I'm not being correct here. I think it's important that it is emphasized at this age, at the 5-year-olds, that this is not something that they did. So you want to make it clear, however you explain it, that it's a disease that you were just born with, and you're not being punished by anybody. You're not being punished by mommy and daddy. The doctors aren't doing this to punish you. A chronic illness. I mean, in medicine we have all these euphemisms. Chronic illness basically means an incurable illness. It just means you're going to have it for a long time. And so I think it's important to say, yeah, you have this, and you're going to have this a long time until you become a grown-up. Just simple things like that. I don't think you have to go beyond that for a 5-year-old. And I think you always have to couch it with a little bit of positive reinforcement as well, saying, yes, you have this illness, you have this disease, and it's going to make you sick, but there are medicines to help you get better. We're going to keep doing everything we can to help you get better. The doctors are going to help you. The nurses are going to help you. Mommy and daddy are going to help you. And instead of explaining why they are different than others, I think it's important to point out how they're the same as others. Saying that, yeah, you can go to school, but you may not be able to eat, just like all the other kids, but you may not be able to go on this field trip because you might get sick on this field trip. Or you can have friends over, but I don't think you're able to sleep over their house because you have these medicines that you have to take. So I think you reinforce the part of their life that's the same, and try to minimize the part that's different. And again, I don't have exact answers.
And to add that, I think you could simplify it too. The soldiers in your body that fight off infections are not working really well, and if a germ enters your body, you could get really sick. So this is why we take medications, is so you could have those soldiers to fight off those infections or those germs. Very simple, and a 5-year-old can respond to that simple terminology.
And there's a question, I assume it's about this.
I know the idea after the group also has resources for that. Are my immune system a steeper scale and here's the kind of thing. And I know our son who's also 37.
And that's a much better answer than I gave. I was talking more generalities, but in terms of explaining the immune system, the IDF resources are excellent.
Are exceptional. I agree. How do I find counseling for my child that has the knowledge of his condition? You could use, it's really difficult to find a therapist that has experience working with chronic illness and with working with mental health diagnosis. Honestly, it's very, very difficult to find a specialist in that area. But many, if you find just in general therapy services, what you typically go through is through your insurance. Give them a call and say, and they could provide you a list of mental health providers within your area and that are covered under your insurance, whether it be an HMO, whether it be a PPO. If you have Medicaid or Medi-Cal, then you could definitely ask a social worker within the department or your clinic or a case manager to assist you in finding other community health clinics mental health clinics that provide services to children in general. A lot of things that come up with having a PI diagnosis are similar to in terms of anxiety and depression, that they could assist with those symptoms. And a lot of times anxiety comes with or prior before getting your blood drawn or just having difficult procedures in general.
Can somebody please ask an easy question? So, what do we do as parents about keeping our kids away from unvaccinated kids? Man, I don't have an answer to that. I mean, we're all huge proponents of vaccines. You are probably among the people out there who wish the vaccines would help their kids. You have a whole group of parents who are avoiding the vaccines, and you're like, I just wish I could give my kids vaccines to help them, as they don't even help because their immune system is so low. I think that, first of all, you're probably being, and I'm not saying this to be depressing, you probably don't know half the people who are unvaccinated. So I think life is not zero risk. If you leave here today and you go to Disneyland tonight, probably some kids there are unvaccinated. And so you can't keep your kid in a bubble, and you have to, as we're emphasizing, normalizing your child's life. So I don't want you not to go to Disneyland because you heard that a couple of years ago there was a huge measles epidemic because all these unvaccinated kids went to Disneyland. Do you not give your child a chance to go to Disneyland, Knott's Berry Farm, all those places down here? So first of all, you're just going to not know, and that's just part of the uncertainty of being a human being and being alive. If you know a child is if you know there's a particular family that their children are unvaccinated, again, it would be hard to, especially if they're in the same classroom, you can't separate or in the same school. I think you have to look for signs of obvious contagion. So there's certain one of these vaccine preventable diseases that are communicable very easily, and certain ones that are not. So things like measles, chickenpox, pertussis, whooping cough, you can pass very easily. They're very contagious. Diseases like tetanus and polio. There hasn't been a case of polio in the United States in 40 years, so I'm not going to worry about polio and things like that. So I think the best you could do, honestly, is stay away from a child who looks obviously contagious, and perhaps you can, in a non-confrontational way, talk to that parent if you're close enough to them to explain, because a lot of people who are denying vaccines are so concentrated on their own child, and they're so afraid of the side effects of the vaccine, they don't realize the effect not vaccinating their child has on other children. And perhaps by pointing that out, you may actually, if that person's on the borderline of vaccinating, you may convince them to vaccinate, which would be good for you and good for them. But I don't know. I've just been babbling away. I don't know if I have a good answer to that question.
I just wanted to add that when we were picking up school for our son, at least in here in Southern California, they had like a map that told you the rates of vaccination to the school. So that was one of our considerations, was what's the percentage of vaccination there.
And that's an excellent point. And I can only speak for California. I don't know where all you are from, but in California recently there was a law passed that with mandatory vaccinations, they've taken away most of the loopholes for not vaccinating child, so personal exemptions and things like that. And the amount of unvaccinated children, at least in the public school system, has dropped dramatically. So actually putting your child, if you're in California, putting your child in a public school is actually safer than homeschooling, because the homeschool kids there's no law to prevent them from being unvaccinated.
So it looks like we've run out of time. I apologize for our last question.
But if you have questions, you can come up here and ask us
questions.
questions.
Yeah, you could always come up to us and ask us.
Thank you for your
Thank you very
attention.
much.